A joint United Nations program on HIV/AIDS is citing new data that show the coronavirus pandemic's long-term impact and global HIV response could result in nearly 300,000 additional new HIV infections between now and 2022, and up to 148,000 more AIDS-related deaths. It is asking countries to adopt ambitious new targets to avoid hundreds of thousands of additional infections and deaths linked to the COVID-19 pandemic.
Before COVID-19, another virus had ravaged the world over. It was HIV and the disease it causes, AIDS. For decades, there has been an international effort to learn about the illness and how to prevent it. Now, the United Nations says there could be some major setbacks due to the latest global pandemic. Achim Steiner, the UN Development Program Administrator, says the coronavirus is now threatening to reverse this hard-won progress. The UN AIDS Program's annual report warns there could be an increase in HIV infections due to COVID-19. It also found 38 million people are living with HIV as of 2019. There were 1.7 million new infections last year, and the death toll in 2019 from AIDS-related illnesses reached 690,000. But it also highlighted some promising figures. The report found new HIV infections have dropped 40% since its peak in 1998. Deaths caused by AIDS-related illnesses dropped 23% since its 2004 peak, and 26 million people were accessing antiretroviral treatments as of June this year. Another UN AIDS report published earlier this year outlined other challenges that remain. It found new infections since 2010 decreased by 38% in Eastern and Southern Africa, the region hardest hit by HIV and AIDS. But it also found cases in Eastern Europe and Central Asia jumped 72% in that same period. Meaning despite massive efforts to stem the tide of HIV in Africa, it's cropping up elsewhere.